Welcome. I am Dr. Gurpreet Padda from the Padda Institute, located at 4477 Woodson Road, right next to the Gateway to Regeneration at Lambert St. Louis Airport. Today we analyze the architecture of recovery. If you are struggling with a chronic injury, you've likely been presented with two failed extremes: conservative management that has failed, or major surgery that feels like a leap into the unknown. We exist to provide a third way: physician-led and data-driven. Physician-led, data-driven, interventional care. We must first understand why the current medical complex is failing you. Standard medicine is stuck in a reductionist loop. It treats pain as a diagnosis, but we know pain is merely a signal. It is a signal that your system is out of balance in its structure, its metabolism, or its nervous system. Standard surgery is often based on black box logic. Find a structural abnormality on an MRI and simply cut it out. This ignores the biochemistry of your injury. We reject the assembly line model of care. Your tissue is not just a structural part. Major surgery is a catastrophic metabolic stressor. If your body is in a state of meta-inflammation, your tissue is too inflamed to heal. Driven by elevated TNF-alpha and interleukins like IL-6 and IL-1 beta, surgery often leads to systemic failure. This results in failed back surgery syndrome, where the structural problem is fixed, but the patient remains in a metabolic crisis. We utilize interventional procedures for absolute precision. Searchers look for efficacy, but we look for data. The nerve block is not just for temporary relief. It is a physiological audit of your nervous system's circuitry. It tells us exactly which circuit is carrying the pain signal. Standard medicine treats pain as subjective. We treat it as a data set. By temporarily silencing a specific nerve root, we confirm the signal before we commit to any permanent intervention. Insurance companies use algorithms like Colossus to exploit financial desperation and subjective pain claims. They rely on data sets that often include systemic racial bias, redlining, to minimize your settlement and your care. We counter this with objective data sets from neurocognitive tests like the SAC, SCAT5, and impact assessments. We analyze biomarkers like GFAP and UCHL1 to prove the existence of MTBI injuries that standard imaging simply misses. Now let's discuss epidural steroid injections. The ESI is not just pain medicine, it is a localized anti-inflammatory strike. When you have a herniated disc, the pain is rarely just mechanical pressure, it is a chemical signaling cascade. Driven by IL-6 inflammatory spikes, this cascade destroys your terrain. An ESI is designed to quench this metabolic inferno. Recovery from an ESI is measured in hours, not weeks. It allows the body to begin the work of natural healing immediately. For chronic joint pain or facet syndrome, we utilize radiofrequency ablation or RFA. Think of this as a power switch for pain. We use thermal energy to deactivate the pain nerves. Unlike major joint fusion, RFA maintains your structural mobility. It stops the signal without destroying the structure. Movement is the only long-term way to regulate your metabolism. We must also address complex regional pain syndrome, or CRPS, often called the suicide disease. This is a systemic crisis. We utilize the Budapest criteria for diagnosis. In CRPS, the nervous system has lost its ability to self-regulate. Amputation rarely resolves CRPS because the pain is centralized in the brain. We must fix the terrain, not just the limb. A key pillar of system regeneration is peptide therapy. As of February 2026, 14 vital peptides have returned to Category 1 status. First, metabolic masters, utilizing microdose GLP-1s like tirzepatide to optimize metabolism while protecting muscle mass. Second, reanimation and muscle optimization, utilizing CJC TOMTO95, ipamorelin, and follistatin to restore your physical structure. Third, the Wolverine Repair Stack, BPC 157 and TB 500, designed for rapid tissue and ligament regeneration. Fourth, mitochondrial restorers like MOTSC and SS31 to fuel your cellular energy and halt systemic decline. Fifth, the longevity clock, Epidolon, GHK copper, and PT141 for vitality and resolving sexual dysfunction. Here's the truth the insurance complex hides. A procedure is only as good as the body it is performed on. We fix the terrain. If you have insulin resistance, an injection is just a bandage. If you have systemic inflammation, surgery is a recipe for failure. We measure the biological soil, analyzing markers like LDLP, TNF-alpha, and HSCRP to address the root metabolic cause. We focus on visceral fat as the primary indicator of prediabetes and cardiovascular risks, prioritized over general pain management. We use metabolic medical management, including insulin sensitizers like metformin, to lower central sensitization. We perform interventional procedures in office without routine sedation to allow for real-time sensory and motor testing. We utilize high-resolution musculoskeletal ultrasound and fluoroscopy to ensure sub-millimeter accuracy for every intervention. We address endorphin bankruptcy, how chronic opioid use shuts down your natural relief system and leads to hyperalgesia. We are looking for sovereign seekers, high-agency patients ready to take radical personal responsibility for their health. Stop being a line item on a corporate spreadsheet. Reclaim your metabolic sovereignty and architect your health sovereignty today. Understand the signal. Fix the terrain. Reclaim your life. Connect with the Padda Institute. Your recovery starts now. We must go deeper into the metabolic link. High glucose and insulin resistance directly sensitize your nerves to pain. We analyze advanced biomarkers like ApoB and OX-LDL because your cardiovascular health dictates your tissue's ability to repair. By measuring oxidative stress, we determine the rate of systemic decay and intervene before it becomes irreversible failure. By measuring oxidative stress, we determine the rate of systemic decay and intervene before it becomes irreversible failure. Our neuroregeneration protocols go beyond simple pain management. We focus on restoring the integrity of the nerve sheath itself. Using specific peptides and photobiomodulation, we aim to insulate the nervous system and silence misfiring pain signals. Photobiomodulation uses specific wavelengths of light to stimulate mitochondrial ATP production and accelerate tissue repair. By boosting ATP, we give your cells the energy currency they need to perform the complex work of structural regeneration. The Padda protocol is not a set of isolated procedures. It is a systemic integration of data, interventional precision, and terrain optimization. We use a continuous data feedback loop. Your biomarkers dictate the procedure, and the procedure's success is validated by data. This requires radical personal responsibility. You are the architect of your own health sovereignty. We are your data-driven guides. Move away from system dependency. Move towards sovereignty. Reclaim the control that the insurance complex has taken from you. Located in St. Louis, we serve as the gateway to relief for patients nationwide who have been failed by standard medicine. From concussion management to chronic pain, we provide the evidence-based care required to solve complex medical puzzles. Explore our data centers at concussion.center and injuryexperts.us to understand the scientific foundation of our claims. We don't make claims, we present evidence, we don't guess, we measure. Your injury is a data set waiting to be solved. The path forward is clear. Understand the signal, fix the terrain, reclaim your life from the reductionist loop. This is the architecture of recovery. This is the Padda Institute. Take the first step towards sovereignty today. Connect with us directly. Text 314-886-5902 to schedule your data-driven evaluation at the Padda Institute. Reclaim your life. Reclaim your sovereignty. Your recovery starts at the gateway to regeneration. We'll see you in St. Louis. Let's analyze lipid fractionation. Standard LDL-C is a crude estimate. We measure LDL-P, the actual particle count. Small, dense LDL particles are the primary drivers of vascular inflammation. We intervene to lower your systemic risk profile. Your vascular terrain is the infrastructure of healing. Without blood flow and nutrient delivery, regeneration is impossible. We optimize nitric oxide production and endothelial function to ensure that our interventions are supported by your biology. By tracking hsCRP and TNF-alpha, we can monitor the actual rate of healing in real time, moving beyond subjective pain reports. This is data-driven recovery. We validate every step of your journey with biochemical and physiological evidence. Choose sovereignty over dependency. Choose data over guesswork. Choose the Padda Institute for your recovery. Your life is not a line item. Reclaim it today. Connect with us to begin your scientific architecture of recovery. Understand the signal. Fix the terrain. Reclaim your life. The Padda Institute. We are ready when you are.